have always had an interest working somewhere in the medical field, but I have not previously known where. I did not consider going into anesthesiology until one of my mom's good friends was telling us that it is a very good job and it is on very high demand right now. I have been researching this career option for a while now, and I'm going to share some of the information I have found. It is important to inform others on the need for anesthesiologists and their role in the medical field because surgery and procedures could not be performed without them. The first point is that there are several educational requirements to become an anesthesiologist. According to the TSA, undergraduate students have to complete a liberal arts requirement before entering further studies. A pre-med course of study is recommended, and most colleges offer standard pre-med curricula. Next, the students have to complete a bachelor degree, which is 4 years before entering into med school. Once the bachelor's degree has been successfully achieved, students can apply for med school, and once they are accepted, they begin their 4 years of graduate education, leading to an MD, which is a medical doctor, or a DO, which is an osteopathic physician. Next, after everything is accomplished in schooling, the anesthesiologists in training have to complete 4 years of anesthesiology residency at an anesthesiology training facility. Here is a picture of anesthesiologists in training and their anesthesiologist, which is a certified anesthesiologist who is teaching the patients how to safely perform anesthesia on the mannequin. The next point is that anesthesiologists have a major role in surgery and procedures. According to the American Society of Anesthesiology, they are considered the perioperative physician, which means that they care for the patients all around. They care for them before surgery, during surgery, after surgery. The first thing that they have to do is the preoperative evaluation. Anesthesiologists must perform a focused history and physical examination. They have to see the patient's past and present, how their body is reacting to things. They have to look at things like allergies and the medical history in the family. They must review available lab and test results and assess the need for additional testing before surgery just to ensure the safety of the patient. Next is the intraoperative care. That is what is happening during surgery. So the anesthesiologist has to provide continual medical assessment of the patient, which includes monitoring the patient's vital life functions and their vitals, which are things like heart rate, blood pressure, oxygen levels, and on. And they must control the patient's pain level and level of consciousness to make conditions safe for the surgery. If a patient comes out of the anesthesia while under surgery, it can seriously harm the patient. So it is important that the anesthesiologists are monitoring the patients at all times. They also have to provide post-operative care, which is care after the surgery has been done. They have to monitor the patients coming out of anesthesia to make sure that their bodies are reacting correctly. They also have a role in trauma medicine. In this, their role includes the provision of medical assessment and diagnosis, respiratory and cardiovascular support, which is their breathing and their heart, and infection control. So many times anesthesiologists working in the trauma medicine will have that role to diagnose the patient, assess the patient, and just see what is wrong with the patient. They are also qualified to administer drug therapies or perform special techniques for acute, chronic, and cancer pain. The third point is that anesthesiologists have a very good job outlook. According to Gap Medics, with a population growing, the demand for medical professionals will continue to grow, especially for anesthesiologists since right now they're very high demand. Job growth for anesthesiologists is expected to increase 10 to 20% over the next decade. And here I have a chart showing the growth levels of anesthesiologists growing all the way up to 2023. With a higher demand, they will get paid more. According to Gap Medics, the average salary for an established anesthesiologist can range from $330,000 to $423,500. The income varies between the facilities that you work for. Anesthesiologists have an important role in the medical field. They are responsible for caring for patients at all times. There is a long process of schooling and training, but in the end, it is worth it. With anesthesiologists at such a high demand, the rewarding is very large. Thank you.